Heart disease is the leading cause of death in the United States. Dr. Chip Martin-Chafee with CentraCare Health here in St. Cloud has a lot of important information on this topic. Welcome.
Thank you.
So you like to tell everybody the best way to live their life so that we can avoid this.
Absolutely. I like the mnemonic FATS, F-A-T-S. The F stands for fats, and specifically trans fats. Those are those partially hydrogenated oils that are added to foods. But trans fats increase our risk of heart attack and stroke and even the development of type 2 diabetes mellitus. So we need to find those foods that say zero trans fats, and those should be a mainstay of our diet.
So really look at those labels and try to eat as much whole food as possible.
Absolutely.
The A in fats stands for activity. And that's important for all of us.
Absolutely. The American Heart Association now says we need at least 160 minutes per week of aerobic activity. So if you and I went out and exercised together for 35 minutes or so, we would be sweating a little bit at the end of that activity, but we could carry on a conversation the entire time we were working out together. That's excellent aerobic activity.
So it doesn't have to be hardcore for it to be beneficial for your heart?
Absolutely not.
Okay. Tobacco. We all know we should avoid tobacco.
Absolutely. There is simply no upside to using tobacco, whether you smoke it, you chew it, or use e-cigarettes. If you don't use tobacco, don't start, and if you do, you should stop now. Tobacco use increases our risk of stroke, heart attack, and cancer formation. We need to just stay away from it.
Do you think young people are getting that message?
Oh, without a doubt. There's less teenage smoking now than there's been for the last 5 years, so it's all looking very good.
And even when it comes to the e-cigarettes and the chewing tobacco, it's all bad.
Yes, it seems like teenagers have gotten that message to avoid tobacco byproducts.
That's fantastic. Next, we have sleep. Important for all of us to remember and be reminded of.
Yeah, definitely. We need at least 7 to 8 hours of sleep every night. As busy people, it's easy to say, well, I'll catch up on my sleep next weekend, but you really can't catch up on sleep. If it's gone, it's gone. And we know that car accidents are caused many times by people that have been sleep deprived and just fall asleep at the wheel. So we need to keep ourselves, our families, and other drivers safe and get enough sleep.
I think many of us as parents are always getting those kids in bed early, but then we stay up to get some things done and to catch up. But it's not good for us as a
No, we need 7 to 8 hours to function excellent the next day, and we should just really try to get to bed as early as possible.
You as a cardiologist really concentrate on getting kids to learn a healthy lifestyle very young.
Absolutely, and if our parents model good lifestyle choices and behaviors, our kids will pick up on those things and incorporate them into their lives as well.
A lot of good information. Thank you so much. Appreciate it. For more information, just go to feelinggoodmn.org.